Hi, and welcome to the my video about being a patient and being someone who is about to undergo a microdiscectomy. So here's my story: is that I have actually tried pretty much everything you possibly could have done to try and resolve this on its own. And after 15 years of dealing with back pain and the last 2 of being in constant therapy or acupuncture or some sort of something that's going to help me, whether it be physical therapy or chiropractic or acupuncture, alternatives, and both traditional and alternative medicines, I have come to the point where my only option left is surgery. So I just wanted people to know what it's like to be on the receiving end, and I want you to follow me through this. I'm going to continue to make videos. I'll probably make something or put together a little something on the day I do go into surgery, and I'll be sure to follow up afterwards and let people know how I'm doing, because I'm sure there's somebody out there that could use this perspective. So if you're undergoing a microdiscectomy or any surgery for that matter, I think it's extremely important that you find the right team. In the situation of a herniated disc, not all herniated discs actually do require surgery. A lot of these do repair themselves. However, if you do have to undergo surgery, I think it's very important that you call some other medical professionals. Don't just call the doctor's offices, but actually call physical therapists, and even talk to, if you know, some x-ray techs or some ultrasound techs or a phlebotomist even. You'd be surprised at all the inner knowledge that these people have. I've called nursing friends. I've called basically everybody I know to see who they would go to if it was happening to them. So if you are not actually in the medical community, literally if you know anybody or if you know someone who knows somebody, I think you really should use those resources. So when you're creating that team, you need to make sure not only do you have a good physician who's going to explain things well and somebody that you are comfortable with, you have to make sure that you also have a good rehab team to follow up with, because you are probably going to be in physical therapy for a minimum of a month, but I'm thinking I'm probably looking at a little longer than that. So I will keep you updated as to what happens with that, because at this point I really honestly don't know what to expect on the receiving, the ending stages of this, I should say. So as far as the recovery at this point, from what I've been told, that I have a series of weight restrictions that I will be having to adhere to for the next few months. For the first month, I can lift between 5 to 10 pounds is what I've been told. Second month will be up to 25 pounds. And the third month, I will start being able to lift up to 35. Beyond the third month, I should start being able to return to normal activities as able. For me personally, the hardest thing is that I have children. I have a 7-month-old who weighs 14 pounds and a 2.5, almost 3-year-old who weighs 24 pounds. So, and you know, she could actually weigh 25 to 26 now, but for me in particular, that's going to be extremely difficult. So currently I plan on actually maintaining a fairly decent activity level after I have this surgery. I hope that I'm able to stick to what I'm saying, but I do plan on taking multiple short walks. After my wound heals, I will be going swimming at an indoor pool. I actually have access to one, so I've been lucky in that respect. And our weather is nice enough in this area that I happen to live in that I will be biking up until it is probably freezing outside. My hope is that maybe by the end of spring, I'm hoping that I'll be back to a little bit of skiing. At the very least, maybe I'll be able to do a little bit of snowshoeing or some downhill, or not downhill, I'm sorry, I'd be able to do a little bit of cross-country skiing. But at this point, it's kind of hard to tell where I'll be at. I am hopeful for the future. I think this is honestly just the beginning of a new and improved life for me, because like I said, I've been in pain for a very long time, and this will definitely change my life, probably for the best. So the last thing I just have to say is I will be back again tomorrow, because tomorrow is my pre-op appointment, and that is something that is basically the last one-time meeting with that neurosurgeon. I'll be doing my surgery, and we're going to go over the procedure once again, and I will be going in with a list of questions. If there's anything that you guys want me to answer for you, I've honestly probably asked it myself. I've asked so many questions of these people that I can tell you what I've been told and from my perspective, but I'll let you know how it goes and what kind of lab work we do and all of that fun stuff, and what I'll be doing the night of and the morning of my surgery. So wish everybody well. Cheers to all of you, and best wishes to anyone else who might be going through this.